Have you ever considered that certain activities, even those considered private and personal, might require a different approach as we age? Most people tend to think of health advice primarily in terms of diet and exercise, assuming that as long as they stay active and eat well, everything else will fall into place. But the truth is, as we pass the age of 65, our bodies undergo significant changes, and what was once perfectly safe or even beneficial might require reevaluation. In the often unspoken realm of personal well-being and sexual health for seniors, there's a crucial aspect of self-pleasure that is frequently overlooked or simply not discussed: masturbation after 65. While it remains a healthy and normal part of life, there are specific practices that, if not managed carefully, could unknowingly put a strain on your cardiovascular system and disrupt your delicate hormonal balance. This video will uncover 5 unexpected, yet critically important things you must never do while masturbating after 65 to safeguard your heart and hormones. These aren't judgmental rules. They are practical insights rooted in understanding the aging body. By being aware of these often missed pitfalls, you'll not only protect yourself from potential harm, but also optimize your self-pleasure experiences for genuine, long-term health benefits. This video will help you understand the subtle physiological responses in your body as you age and how you can work with them, not against them, to maintain your vitality and well-being. And here's the reassuring part. Once you know these vital pieces of information, you can easily make adjustments to ensure your health remains a priority. Stay tuned until the very end, because the 5th point we discuss might be the most crucial one for your overall long-term health and peace of mind. Now, let's explore the first thing you absolutely must avoid. Mistake 1. Ignoring pre-existing heart conditions. This is perhaps the most critical consideration for anyone over 65. And it applies directly to physical exertion during masturbation, just as it would to any other physical activity. If you have a diagnosed heart condition, be it high blood pressure, coronary artery disease, arrhythmias, or a history of heart attack or stroke, ignoring these conditions and pushing your body too hard during masturbation can be extremely dangerous. Sexual activity, including masturbation, causes a temporary but significant increase in heart rate and blood pressure, similar to moderate exercise. Your heart works harder to pump blood, and your blood vessels constrict. While this is generally healthy for a strong heart, for an aging heart that may already be compromised, this sudden surge can place undue stress on the cardiovascular system. It can lead to angina, chest pain, shortness of breath, palpitations, or, in severe cases, even trigger a cardiac event like a heart attack or stroke. Many seniors might feel embarrassed to discuss this with their doctors, but this silence can have severe consequences. The idea is not to stop self-pleasure, but to approach it with awareness and caution, respecting your body's current limits. Consider the story of Mr. Johnson, a 72-year-old widower who had a history of angina, but rarely experienced symptoms thanks to his medication. He often engaged in masturbation as a form of stress relief. One evening, after a particularly intense session, he experienced severe chest pain and breathlessness, leading to an emergency hospital visit. It turned out the sudden exertion combined with his underlying heart condition had pushed his heart beyond its capacity. His doctors emphasized that while the activity itself wasn't the problem, the intensity and lack of awareness of his body's signals were. He had unknowingly been putting his heart at risk during these private moments. If you have any pre-existing heart condition, consult your doctor about safe levels of exertion during sexual activity, including masturbation. They can provide personalized advice based on your specific condition and medication. Pay close attention to your body's signals. If you experience chest pain, dizziness, severe shortness of breath, or unusual discomfort, stop immediately and seek medical attention. The key is to approach the activity with gentle moderation, focusing on pleasure rather than intense exertion. Prioritizing your heart health by being aware of and respecting pre-existing conditions during masturbation is paramount. This vigilance directly reduces the risk of dangerous cardiovascular events, ensuring that self-pleasure remains a safe and beneficial part of your life as you age. Mistake 2. Over-relying on external stimulants. While pornography and other forms of visual or auditory stimulation can be part of a healthy sexual life, excessive or sole reliance on them, particularly as we age, can have negative implications for your hormonal balance and brain chemistry. It's not the content itself that's the issue, but the way over-reliance can potentially impact your natural responses. When you consume highly stimulating content, your brain releases a significant surge of dopamine, a neurotransmitter associated with pleasure and reward. While dopamine is essential, constantly seeking higher and higher levels of stimulation from external sources can desensitize your brain's natural reward pathways. This means your body might become less responsive to endogenous, internally produced forms of pleasure and arousal. For older individuals whose hormonal systems are already undergoing changes, e.g., declining testosterone in men, fluctuating estrogen in women, this desensitization can exacerbate feelings of decreased libido or difficulty achieving arousal without intense external stimuli. It can create a psychological dependency where your body expects a certain level of artificial stimulation, leading to a diminished capacity for natural arousal and a potential dampening of your body's own hormonal responses. This can lead to a less fulfilling experience overall and a sense of dissatisfaction when high stimulation isn't present. Consider the case of Mr. Davis, 68, who, after his wife passed, found comfort in pornography. Over time, he noticed he needed increasingly extreme content to feel aroused, and when he tried to engage in self-pleasure without it, he felt a marked lack of interest and physical response. His brain had become accustomed to the intense, rapid-fire dopamine hits from the external stimuli, making his body's natural, gentler arousal mechanisms seem insufficient. This created a cycle of dissatisfaction and dependency, which contributed to a general feeling of hormonal imbalance and low libido, even when he wasn't engaging in the activity. Strive for a balanced approach to stimulation. While occasional use of external content is fine, try to incorporate self-pleasure experiences that rely more on internal sensations, imagination, and tactile exploration. This helps to keep your body's natural arousal pathways active and responsive. Explore different forms of touch. Focus on deep breathing, and allow your imagination to play a more central role. The goal is to avoid creating a dependency that overrides your body's innate ability to respond. Moderating reliance on external stimulants helps maintain your brain's natural dopamine sensitivity and supports a healthier, more balanced hormonal response to arousal. This fosters a more fulfilling and sustainable self-pleasure experience that relies on your body's inherent capacity for pleasure, rather than creating an artificial dependency that can negatively impact libido and hormonal harmony. Mistake 3. Engaging in strenuous positions or prolonged sessions. As we age, our bodies naturally become less flexible. Our joints may suffer from arthritis, and our muscles might be less resilient. Therefore, engaging in overly strenuous or contorted positions or prolonging sessions for an excessive duration can put unnecessary strain on your musculoskeletal system and potentially impact your cardiovascular health. While masturbation is generally safe, pushing your body into awkward positions can lead to muscle strains, joint pain, or even injuries like sprains, especially in the back, neck, or hips. An aging body requires more gentle movement and respect for its limitations. Furthermore, prolonged sessions, particularly those involving sustained high levels of arousal and physical activity, can put an extended strain on your cardiovascular system. Your heart rate and blood pressure remain elevated for a longer period, which can be taxing for an older heart. This isn't about rushing the experience, but about recognizing that moderation and comfort are key. Pushing for prolonged intensity can also lead to fatigue and general depletion, affecting your overall energy and recovery. Think of it like trying to perform acrobatics when your body is built for gentle stretches. Mrs. Thompson, a spry 70-year-old, once attempted a position she'd seen online, hoping to enhance her experience. She ended up with a severely pulled hamstring that kept her in pain for weeks, requiring physical therapy. Similarly, Mr. Lee, 69, would sometimes engage in very long, intense sessions, hoping to maximize pleasure. He found himself feeling unusually exhausted and lightheaded afterwards, attributing it to age, when in fact it was the prolonged cardiovascular exertion that was draining his reserves and putting undue stress on his system. Prioritize comfort and safety above all else. Choose positions that are natural, relaxed, and don't put strain on your joints or muscles. Listen to your body. If you feel any discomfort or pain, adjust your position or stop. Similarly, be mindful of the duration and intensity. Focus on quality over quantity. Shorter, more pleasurable sessions that respect your body's limits are far more beneficial and safer than pushing yourself to exhaustion. Avoiding strenuous positions and prolonged sessions protects your musculoskeletal system from injury and reduces prolonged cardiovascular strain. This ensures that masturbation remains a safe, comfortable, and pleasurable activity that supports your physical well-being rather than causing unnecessary wear and tear on your aging body. Mistake 4. Neglecting hydration and post-activity recovery. This might seem like a minor point, but for individuals over 65, neglecting proper hydration before, during, and especially after physical exertion, including masturbation, can have a noticeable impact on your cardiovascular health and overall well-being, influencing hormonal balance indirectly. Dehydration is a more significant risk as we age due to decreased thirst sensation and changes in kidney function. Physical activity, even moderate, causes your body to lose fluids through perspiration and increased respiration. If you're already mildly dehydrated, this fluid loss can make your blood thicker, forcing your heart to work harder to pump it through your circulatory system. This increases cardiovascular strain and can lead to symptoms like lightheadedness, fatigue, and even exacerbate existing conditions. Proper hydration also plays a crucial role in maintaining optimal cellular function, including hormone production and regulation. When your body is dehydrated, it's under stress, and stress itself can disrupt hormonal balance, including cortisol levels. Furthermore, neglecting recovery, rushing back into daily tasks without a moment of rest denies your body the chance to regulate blood pressure, heart rate, and return to a state of calm. Consider Ms. Rodriguez, 74, who enjoyed her private moments but often felt drained afterwards, sometimes experiencing headaches. She attributed it to getting old. After a doctor suggested she ensure proper hydration and take a few minutes to rest post-activity, her post-masturbation fatigue and headaches significantly decreased. She realized she was often mildly dehydrated before starting, and the activity simply amplified that deficit. Her body was experiencing unnecessary stress that could have been easily mitigated. Make a conscious effort to stay well hydrated throughout the day, not just around the time of masturbation. Consider having a glass of water before and immediately after the activity. Following the session, take a few minutes for gentle recovery. This could involve simply lying still, deep breathing exercises, or a short period of relaxation. Allow your heart rate and breathing to return to normal naturally. This mindful recovery supports your cardiovascular system and helps your body transition back to a resting state, minimizing undue stress. Prioritizing hydration and incorporating a brief recovery period safeguards your cardiovascular system by reducing strain and supports overall cellular health. This subtle but significant practice ensures your body can efficiently manage the physiological responses to pleasure, contributing to a healthier heart and more balanced internal environment as you age. Mistake 5. Don't let guilt or shame dominate your experience. This final point might seem less physiological and more psychological, but its impact on your heart and hormones can be profound. Allowing feelings of guilt, shame, or embarrassment to dominate your masturbation experience after 65 is incredibly detrimental to your overall health and well-being. For many older adults, societal norms, cultural beliefs, or even past experiences can lead to negative feelings around self-pleasure. This internalized negativity, however, doesn't just disappear. When you engage in an activity while simultaneously experiencing guilt or shame, your body enters a state of internal conflict. This triggers a chronic stress response, leading to the release of stress hormones like cortisol and adrenaline. While the physical act itself might bring pleasure, the underlying emotional turmoil negates many of its benefits and introduces significant harm. Prolonged exposure to elevated cortisol levels is linked to a myriad of health problems, including increased risk of cardiovascular disease, high blood pressure, arterial damage, impaired immune function, hormonal imbalances affecting libido, sleep, and mood, and accelerated cellular aging. Essentially, the mental stress you impose on yourself through shame can be more damaging than any physical exertion. It's like poisoning a beneficial activity with negative self-talk, turning a potentially healthy release into a source of chronic, internal stress. Consider Mrs. Miller, 70, who, despite enjoying masturbation, carried deep-seated shame from her upbringing. Every time she engaged in it, a voice in her head would chastise her. She often felt a tightness in her chest and a general sense of anxiety afterwards, which she couldn't explain. Unbeknownst to her, this constant internal battle was causing her body to release stress hormones, impacting her heart and disrupting her delicate hormonal equilibrium, leaving her feeling worse, not better, after a moment that should have been purely pleasurable and relaxing. She was literally stressing herself sick over something that should be a healthy part of her life. Actively work to shed any lingering guilt or shame surrounding masturbation. Recognize that self-pleasure is a normal, healthy, and beneficial part of human sexuality at all ages. Frame it as an act of self-care, stress reduction, and maintaining intimacy with your own body. If deep-seated feelings persist, consider talking to a therapist or counselor specializing in sexual health or aging. Focus on the positive feelings, the relaxation, and the natural release that the activity brings. Embrace it as a healthy aspect of your life. Releasing guilt and shame during masturbation protects your mental and emotional well-being, which directly translates to a healthier hormonal profile and reduced cardiovascular strain. By allowing yourself to experience pleasure without judgment, you minimize chronic stress, lower cortisol levels, and support a more balanced physiological state, contributing significantly to a healthier heart and a more vibrant life beyond 65. As we've explored, while masturbation remains a healthy and natural part of life at any age, approaching it with mindfulness and awareness becomes especially important after 65. By understanding and actively avoiding these 5 critical pitfalls, ignoring pre-existing heart conditions, over-relying on external stimulants, engaging in strenuous positions or prolonged sessions, neglecting hydration and post-activity recovery, and allowing guilt or shame to dominate your experience, you can transform self-pleasure into a truly beneficial act of self-care. The core message here is clear. Your sexual health, including masturbation, is an integral part of your overall well-being and longevity. It's not just about what you do, but how you do it, and the mental and emotional state you bring to it. Respecting your aging body's needs and fostering a healthy mindset are paramount. These aren't restrictive rules. They are empowering guidelines to ensure that self-pleasure remains a safe, pleasurable, and health-enhancing aspect of your life. The good news is, these adjustments are entirely within your control. You have the power to make conscious choices that honor your body and promote your well-being. It's never too late to embrace a more mindful and health-conscious approach to your personal life. So, take a moment to reflect. Which of these 5 crucial points resonates most with you, and which change will you commit to implementing for your own health and peace of mind, starting today? Thank you for watching and for being open to this important discussion. If you found this video helpful and believe in the importance of holistic health, please consider giving it a like, leaving a comment below to share your thoughts, and sharing it with someone who might benefit from this candid and vital information. Don't forget to subscribe to our channel and hit that notification bell so you won't miss our upcoming videos on healthy aging and overall well-being. We'll see you in the next one.